Now, this is one simple example which I took it. That RNC actually in terms of a conditions and the diseases runs into thousands. For every condition, there is a schedule which is available saying this is what you need to charge it for a location.
The consultation charges and vis-a-vis all
Absolutely, that's
the
what I'm
other.
saying. Run into thousands. It's a consultation charges. It's a, let's assume you go for a dialysis, or if there is a cardiac surgery, there are different type of cardiac surgery. So it runs into thousands. Right.
Now, my question, I am SP Singh, I am from SPQC, I am advisor of this company. Now, my question is not on this rate of hospital room rent is concerned. If I have taken insurance coverage and I am entitled for 2,500 per day, and if I opt for a single room in Fortis or Max, or the rate is something around 5,000 or 4,000 something. Now, I am prepared to forego the 2,000 or 2,500 rupees per day as far as my accommodation is concerned, because as against, I mean, shared room, I am preferring single room, right? But worry is not that. These hospitals, they have got different rate for single room and double room and this dormitory. Now, how come for the same treatment, say dialysis or knee operation or say whatever, is different? Because this OT is same, doctor is same. So anything can be done on this aspect, because TPA will fleece the insured on this account.
So I'll tell you, you've raised a very valid point. Now, that's a dilemma which we live in India. The same doctor, when he reaches an ICU, will charge you 600 bucks, and when he is sitting in an OPD, will charge you 200 bucks. That's what the industry is. That's what the providers are. So hence, when you try to move from a single room or from a shared room to a single room, everything else which is attached to that room, whether it is a consultation fees, whether it is a surgery which needs to be done, or even the usable things which needs to be used there, they vary.
No, but is it right or is it wrong?
I would not be able to comment on it. I'm saying this is what the network
No,
segment is on.
ma'am, your company prefers this self-management, not TPA,
Absolutely.
if I'm not wrong.
Absolutely right.
But but the problem lies on those health insurance companies who have TPA as their administrator.
In spite of trying by the insurance companies so hard to have a costing done for each treatment or investigation, it's like a mirage that we have been chasing for last so many years. Because hospitals do not subscribe to this view. They say that our quality of treatment is different. The land we have built our hospital is different, and each of our procedures are different. There are so many variations in the lab tests, the technique they use. So it's not possible because the costing is variable. Each one uses claims that their quality of treatment is different. Accreditation costs something. EMR costs additional. If they're disposing their biomedical waste scientifically, that will cost even more. So it can't be standardized across the board.
But for the same doctor, can it be
You are talking about same. I think there's a difference between what we are talking about the same treatment being given in a general ward, in a private room, in a single bedroom, I mean single room or deluxe
Hospitals
room or
claim that
something.
they are subsidizing. They're doing
Absolutely.
cross subsidy.
See, it's a pricing strategy which they are using where all related fees are directly proportional to the room type you are using. For the presidential suite, your 20,000 rupees is the room rent, and you are charged for a simple surgery, you may be charged 5 lakh rupees. For the same surgery in the thing, the room rent may be 500 rupees and you are charged 30,000 rupees. But that's the pricing strategy which is, I think getting into pricing may not be a correct thing at this. When we talk about, and it may be as he says, never ending debate that how do you, I think pricing is something which let the market decide. On the long run, it's where more number of hospitals come in, where more number of healthcare institutions come in, I think pricing is going to stabilize. You, you,
One analogy which is very weird. You watch the same circle, the first seat costs you 250, the last seat costs you 50.
absolutely.
So you go and argue with hospitals. I am not from the hospital committee, but
It is.
Okay, just digressing from our insurance, you see, let me come back to Dr. Rajendra Gupta's first lecture. See, one dilemma which we always have in M-Health is, whenever any advice or any content is acquired, the validation of that particular set of advice or procedure or whatever which we get on the, any thoughts on that, on the content which comes as a advice on a mobile unit to a person who may be sitting in a rural environment.
I still got it. See, there are three people answering you, so mine job is done,
No, I have a similar, I'll explain it to you. It's a corollary of his question only. Basically, I have a similar doubt. That will explain it to amplify to you. Basically, our concern is that as of now, any pilot project is not being established, any content or application is not being validated, and there's a certain amount of hype that has been built around M-Health that it is over-promising to deliver. So do you agree, is there a hype, or all these pilot projects have been validated or not?
May I answer your query?
See, we are dealing with this issue.
Well,
I
yeah.
can tell you.
Well,
That's why
I can tell you, M-Health,
there are a lot of governmental bodies where we are working on this.
well, M-Health, I would,
The content which is delivered,
I would try to elaborate on M-Health or any consultation or opinion you seek on the internet sort of thing. Because you are working, suppose, independently. You are a consultant, medical consultant. You are not supported by ICT. You are acting at your own. Now you want a little support and supplementation of what is your thinking. And in the medical realms, it is not only a single word. You will ask for investigation to prove your point. There is no worry about it. What M-Health tells you, you have to substantiate later on with some investigation touch, which will provide you real guidance. Okay, well, you have to think on this option as well. So there is nothing wrong on M-Health at all.
Also that M-Health doesn't do investigations, on its own. You get an advice and you get a referral. So I think it is limited to a scope of delivering services, and which it does very effectively. Now the question is whether it will be questioned or not, depends on what's the outcome of the treatment. If it goes good, no one is going to question. If it goes wrong, you're going to question.
Actually, it's a distribution which gets
Yes, yeah. So it's more of distribution, thing that gets handled through mobile health.
I think
Yeah,
it's
thanks.
a drowning man. If you catch at a straw, you swim across.
Any
Well,
we are a part of the telemedicine act
I tell you,
We are trying to get to that.
I can tell you there are millions of citations and information in the text. Are we applying every bit of text for the utilizing our knowledge? Not at all. We are only utilizing about 20%. Our submission is through our creativity, you can use about 80-90% of knowledge. So if you want to take a little sport and supplement your idea, you are independently working without a sport. Now you have got something, a star to stand by, and you can qualify your thinking through a sort of investigation. There's nothing
I think.
See, what I mean is,
Just one minute. Is there any other question? If not, then yours will be the last. Okay. Okay.
the question is, see, there are a lot of websites on the internet. They are professing to give lot of information about lot of diseases. What I am trying to say is, question is that kind of information which is floating around, what is the check on that? Or can we believe that? Yeah.
Of wellness is and what exactly you all do. Is it smoking, non-smoking, diabetes, obesity, things like that, or how does wellness fit into your regular, because wellness is more end to end, and health insurance unfortunately is slightly more transactional, doesn't necessarily look at the whole disease and managing it. So can you
Yeah,
define
absolutely.
help and define
Absolutely.
little-
So what we are trying to do is, at Max Bupa, we do a underwriting at point of sale. And the philosophy says is that I collect lot of information about a customer with an objective that I want to utilize it effectively for a preventive. Because I want to move into a preventive as well. Now, when I move into a preventive care, what I really want to do is I want to run certain wellness programs. Now, wellness is a very wide term, right? What we are trying to do is from we'll pick up certain set of age group rather than going from a disease angle. Because if you go and visit or if you go and do a study for a lot of people who are outside India, they actually do it wellness programs for a disease or a condition like a diabetes or a cancer or a TB, things like that. We are taking a little different approach. We are trying to study a age group. Let's assume if we get to see a age group 60 to 65, these are common set of diseases. What are the programs that I can run it? Maybe a free health camp, maybe some kind of an advice to be given, maybe somebody visiting them, consulting them, because as an example, somebody who's let's say greater than 70 years of age, if that individual has to go through a surgery, believe me, half of the disease would be sorted out if the guy is consulted rightly. You need to have that individual a mindset being there saying you have to go through a surgery at the age of 70. We are, no, we right now we want to run it as a program. We are starting it with a group companies first, and we are there to make profits. Let's be very frank. So it'll be in right. So it'll be a little different because I have worked in US organizations as well. So I know they look into a disease area. They actually look into that these are the conditions areas. I thought we'll take a little different approach, and we are looking into an age profile. Yes, yes. These are the kind of details we are picking it up. We want to, we have started this program more from a group perspective to see how it works out. Then we'll move into a retail, and cost has to be borne by the group company. So.
I think I think we need to conclude this session.
Okay,
And he wants to share some interesting
Yeah,
information.
just something from Holland, because we are moving much more. I'm also developing software for chronic diseases, and insurance companies are moving much more now to define goals with the patient, and then also say, okay, this patient has diabetes, but it's impossible to keep on paying for everything. It's just too much. So it's also important that the patient shows his own results. So it's much more defining goals with the patient, and then it will be also the patient that is very responsible for his own indicators. So he should stop smoking, and because we are all paying for it in Holland, everyone is paying for all the people that are smoking. So it is impossible to keep on paying for it. So it's moving to that direction where people become more responsible for their own health. So that is the move in Holland.
I think we live for our own health rather than insurance saving money. I'm paying.
Thank you very much. Thank you, audience, and thank you, speakers, for generating a very, very lively discussion, very participative. Thank you very much.